Welcome to Counseling Techniques. Sometimes a counselor might know the skills and techniques required for doing effective drug addiction counseling, but that doesn't necessarily mean that the person is an effective counselor. So to be an effective counselor, it's going to require practice. Practice, and more practice is going to help you to build your experience and allow you to identify opportunities for improving your counseling skills and techniques. So in this unit, we're going to discuss specific counseling techniques that are going to be taught in this course. So the goal of today's lesson is to help you to understand the range of counseling techniques that can be used for effective drug addiction counseling. And at the end of this unit, I hope you will be able to identify a number of counseling techniques that can reduce the risk of relapse and maybe be able to discuss the application and context of counseling techniques in drug addiction counseling. So as a counselor, you should utilize any or all of these techniques that are on the slide, depending on your client's individual circumstance. So we've got problem solving, goal setting, time management, stress management, dealing with our emotions like anger, conflict resolution, relapse prevention, and that's going to include coping with our cravings or refusal skills. We kind of want to just think of these options as a menu from which to choose the appropriate technique. And it can be customized for each of your clients. And it's important to understand that not all techniques are needed for every client. I usually have one or two clients say, well, that doesn't work for me. And so I would typically say something like, well, let's find something that does. And I'll discuss each of these techniques in detail. In just a few moments. But the purpose of this unit is to really just orient you to the set of techniques in this training and to discuss some likely scenarios for when they should be used. You know, these techniques also have utility and application for counseling staff in their personal lives. So think for just a moment. Do you have any experience in problem solving or goal setting? Have you used these techniques before? You know, in order for our clients to achieve the goals established in your counseling sessions, they're most likely going to have to make substantial lifestyle changes and maybe find solution for a number of their problems. And some clients may have so many problems that even minor problems seem overwhelming. And for many clients, their drug use has resulted in avoidance of problems or maybe impulsive decision making. So poor problem solving techniques usually result in negative consequences, and that's going to increase the severity of existing problems or create additional problems, including the risk of relapse. And in counseling, you may need to teach clients how to solve problems identified as critical by both you and your clients. So the use of structured goal setting techniques can really increase client chances of identifying and attaining their goals. And by setting goals on a routine basis, clients can decide what they want to achieve and then move step by step toward achieving those goals. The process of setting goals allows them to choose where they want to go in their lives. And by setting clear goals, they can measure and take pride in the achievement of those goals. And this is also going to raise their self-confidence because they're going to recognize their ability to achieve the goals they've set. In order to conduct a problem-solving and goal-setting session, the counselor should begin with an open discussion to ensure that their client is prepared to face the major problems that they're experiencing. Goals can be set at the beginning of counseling or when you discuss a plan of action with your clients. And if counseling is to be helpful, it really needs to be specific. If you're too vague or general, your clients might walk away from the counseling session without any clarity on what to do. And you're going to learn in this, I do a unit on problem solving, and if you were to take that course, you'll learn that the clients are going to need to try to generate as many solutions as possible because there's never one single approach that works for every person. And you should be able to give your clients choices so that they can choose which one best suits their particular needs. So in a group setting, I will have them determine what their problem substances are and then come up with a goal, and it needs to be specific. So I want to quit drinking alcohol. That's not specific enough. I'll have them say something along the lines of, I would like to quit drinking alcohol by first cutting back to no more than 2 drinks on no more than 2 days a week for 3 months, and then the following 3 months I will have no more than 1 drink per week, and then at 6 months I will completely stop by using my coping techniques and attending meetings. I want them to get really, really specific, and I'll explain to them the SMART goal method: specific, measurable, attainable, realistic, and timely or timed. You want the goal to be specific, very specific. You want it to be measurable because if we don't know at what measure we want the goal to be set at, then we'll never actually reach that goal. We want it to be something that's attainable for us, and we want it to be realistic. I can't fly, so I can't say I want to fly to the moon because I don't have wings. So that's not a realistic goal, but a realistic goal could be, I want to become an astronaut, and I'm going to do the hard work, go to school, do the training, and then become an astronaut, and then I can fly to the moon. That would be realistic. And then we want to have a time limit on it because a lot of us are procrastinators, so we need to put a time on it so that it gives us a clear set of when we need to have certain things done by. And then I will have the clients if their goal is pretty lofty, like I want to buy a house, I'll have them break down the different pieces of the steps that need to be taken, and then they'll break down those steps into smaller, more attainable daily tasks. So if one of the steps to purchasing a house is, I have to fix my credit, well, let's figure out what needs to be fixed on the credit. How do you raise your credit score? All right, you got to pay off some of these debts. How are you going to pay off some of those debts? Well, I can pay a little bit extra this month. And so that would be one step in the process. And then you have to get a good job. Well, how do you get a good job? I need a better education. So you got to go back to school. So let's break down the steps of going back to school. And then we work it that way. So what is one thing that you can do to reach your goal today of purchasing a house? Well, I can look online for degree programs and see which schools offer the degree program that I want to go to. And then a next logical step would be I could apply to that college. And then I could fill out my FAFSA, or I could register for courses. So these are all very attainable, doable steps that each person can take each day. And we want to have those things. But in the problem solving groups that I do, I will give them some sample problems to solve, and I'll have them work individually on one and a small dyad or triad to figure out another one, and then we'll do a large group setting where we work out a problem. I'll typically do the large group setting first so they get the idea of how to do it, and then we'll break it down into dyads and triads, and then they can do one on their own. But I explained to them the 4-step process. The first step is figure out what the problem is. You have to know what the problem is in order to solve the problem. And then the second step is to brainstorm some possible solutions. And then the third step is to figure out the pros and cons of each of those solutions. And the fourth step is to circle on your sheet of paper which one is the most logical and realistic step that you can take to solve that problem. And sometimes we have to take into consideration not just the most obvious answer, but what would stick out to us based upon our goals and our values. And so we have to take goals and values into consideration when we are using our problem solving steps. Time management is a really critical technique in preventing relapse. Clients will most likely have triggers in their lives that might put them at risk of a relapse. So they're going to need to learn how to manage time to avoid risky situations. Counselors can really discuss how to develop a daily schedule, and this can help to provide structure and prioritize activities for the day. A daily timetable, it needs to be busy enough to prevent clients from becoming bored or to start thinking about drugs, because boredom is a high risk emotion for relapse. But the timetable should also not be so tight there's no flexibility in it. We also need to remember that there needs to be time to relax and have fun. Families might also become more supportive when they see, the recovering user settling into a daily routine that's more consistent with a non-drug using lifestyle. So typically what I will have my clients do is think about their routines that they already have. What's your morning routine? What's your workday routine? What's your lunch break routine? What's your afternoon or evening routine? What's your bedtime routine? What is your weekend routine? And thinking about these routines, I'll have them do little daily schedules, basically, and blocking out the times throughout the day. Like, this is what we normally do. And it kind of helps them to see if they have any downtime and where that downtime is so that they can start planning effectively. It's kind of like when we look at our budget, we don't really know how to budget unless we know where our money went last month. So it's kind of looking at time as though it's money. We have to know where our time went last month or last week or yesterday in order to figure out how to allocate it more efficiently today. And so starting out with where did I spend my time yesterday or last week is going to help to determine where I need to start allocating my time more efficiently this week. Like everybody, drug users get stressed, and excessive stress can really increase the risk of relapse and reduce their motivation to apply the other techniques that you're teaching them. And stress can also cause them physical or psychological problems. And as a counselor, you need to identify and discuss issues that are the cause of stress for your clients. And I discuss specific stress management techniques, but you can also share stories from like other people who have had similar problems and how successfully they've managed their stress. So we need to teach our clients that they can avoid or manage stress by maybe thinking about good things in the past or the current, or maybe looking toward the future good things. Sharing with other people their concerns and worries and learning from other people's experiences, and seeking advice from trustworthy friends and family members and counselors or whomever. One of the things that I do in a stress management group, I first will ask them if they understand the difference between anxiety and fear, and helping them to understand that it is the anticipation of that perceived threat. And it's the why questions that we ask ourselves. So we kind of go over that. And then I will explain to them the different types of stress. So we have, regular distress, which is what we're all familiar with. And then we have eustress, which is kind of like a positive stress or a temporary stress, like something a gymnast might experience right before a competition, or when you have a baby, that's a good stress, or getting a promotion at work, or getting a new job, or buying a house. These are all stressful events, but they're good stressors, and they're only for a short temporary time. And then we have hyperstress, which is like you're super overstressed all the time, and then hypostress is when you're just bored and you have, no stimulation in your life and it's boring. And all of these things can have physical and psychological effects on the client. And so we kind of want to explain what they are to the client, while at the same time giving them some of those stress management techniques like thought stopping, challenging or changing any negative thoughts that we're having, challenging the what if questions. So I will usually have a client do something along the lines of asking themselves 3 opposite what if questions. So if the anxiety provoking thought was something along the lines of, what if I wreck my car? I can say 3 things that are opposite of that to myself in that moment, like, well, what if I don't wreck my car? What if I make it there safely, like I do every other time? Or what if I'm a good driver? And that can challenge those irrational thoughts that we're having. Another thing that I will do is I will have them start making a journal of kind of a log of their stress or their anxiety level from 0 to 10, and check in with themselves 4, 5, 6 times a day, and write down what their number is. So 10 being the highest, where there's some sort of consequence. I've hit someone, I've said something that has permanently damaged a relationship, or I've done some sort of physical violence, and now I've experienced the criminal justice system, or I'm in the hospital because I'm having chest pains. That would be a 10. And 0 would be I have absolutely no stress. I'm the most relaxed I've ever been in my entire life. And so checking in with yourself throughout the day, making a note of what the anxiety level was or the stress level was, and then making out next to that notes of, what was I thinking at this particular time? Who was I with? And what were we doing? And maybe another column for extra notes if they want to add another comment in there to further specify what was going on. And as they're doing this, they're going to start noticing that there is a pattern that is occurring where the stress level is higher, and they will start to notice that every time I was thinking about this particular situation, my anxiety level was high. Or every time I was around this particular person, my anxiety level was high. Or every time I'm at this particular place doing this thing, my anxiety level is high. And it's going to help them to start noticing patterns. But it's important to write down all 3 of those things, because it could very well be that the other person that happens to be there when the anxiety is high isn't necessarily the cause of the anxiety. So we don't want them unnecessarily cutting off people, especially if the anxiety-provoking thought had nothing to do with the person that they just so happened to be around. So it's important that they write down all of those factors, because they are going to start to notice a pattern, but it's important to pay attention to all the pieces and make sure that, correlation isn't equaling causation sometimes. You can also use meditation, teaching our clients to meditate to relieve some of the anxiety and the stress that they're experiencing, and teaching them to be very present in the here and now, bringing those thoughts back. So I teach my clients to count their 5 senses. What am I seeing? What am I hearing? What am I smelling? What am I tasting? What am I feeling right now in this moment? And just bringing themselves back. Or we can teach them affirmations like, could happen, probably won't. Or, that's not my circus, not my monkeys. Or something along the lines of, some sort of relaxing, letting it go type of affirmation when they are experiencing these high stress situations. Anger, anxiety, and depression, these are pretty common emotions that drug users experience, and these emotions may also trigger relapse. And anger is often confused with aggression. So we discuss how clients can learn techniques for dealing with anger and how to avoid aggression. And usually I will start this out not so much directly at the client, but I'll kind of use a universal example of, some parents don't teach their child how to effectively handle their anger. And so it'll usually get them laughing. I'll say, don't you stomp in my house. Don't you slam that door. You better fix your face. And and it kind of takes them out of that feeling of you're directly talking to me, and they are able to better identify, because if it hasn't happened to them, then they know somebody, or they've heard it before, they've seen it on a TV show. And so we have to teach them that maybe they weren't effectively taught how to deal with anger, and they were probably taught how to shut down the anger. And while conflicts are unavoidable in human relations, not knowing how to handle them in a healthy way can cause major health and relationship problems. So for drug users, conflict can result in violence or anger and frustration, and this can result in relapse to drug use. So I covered this in another course called Managing Intoxication and Hostility that really assists you in developing strategies with your clients to manage these kinds of problems. But it's important to teach our clients how to effectively communicate with other people. And I stress this a lot in my groups. I will say, I will teach them about the difference between passive communication, aggressive communication, passive-aggressive communication, and assertive communication, teaching them the use of I statements and teaching them how to call a timeout when they're getting frustrated, and maybe some pieces of anger management in there, relaxation techniques, giving and receiving feedback to other people. And I also will teach the fair fighting rules of how to communicate with your partner. So to pick a time and place, that neither one of you are particularly busy, you're not distracted by other things or people, to make sure that it's a comfortable setting, make sure there's no distractions, make sure that the other person is aware of what it is that you want to discuss, picking one topic to discuss, and if anything else comes up, we are making sure that we table that discussion for another date and time. And we want to work toward a resolution and not just talking about all different types of problems, because it's not going to get solved. So the one person will go, they will state what their issue is, and then the other person will use reflective listening, and repeat back to them what they think they heard, so that there is no misunderstanding. And then it's the other person's turn to go. They will state their side of the thing. The other person will say reflective listening skills. What I heard you say was, and then they're able to work that way until they come to a resolution for the situation or a compromise. And clients relapse due to a variety of thoughts or feelings like anger, or maybe through external factors like interpersonal conflict or peer pressure. And while relapse is common, effective interventions can really help clients to regain control and prevent future drug use. So together with the client, you can identify what their high-risk situations are and develop some coping responses. And you're going to need to teach your clients to cope with cravings and to develop refusal skills when they're offered drugs. And I covered that in another course called Relapse Prevention. But just normalizing cravings, teaching the client that cravings are normal. And a lot of them don't understand that it's a normal thing. They think they're the only people who experience cravings, and therefore something is wrong with them. And I'll usually use the example of, how many times have you had a craving for a piece of cake? So they understand that craving is a normal part of this disease, but also a normal part of life. And they might also believe that when they experience cravings, there's nothing they can do to stop them other than returning to the drug use. And so this is where teaching those coping skills is really going to come into play. And while it's best to avoid those high-risk situations completely, like meeting drug-using friends or drug dealers, sometimes that's not practical. and for most, it's not a long-term solution. So drug refusal training is critical to help clients achieve a substantial period of abstinence and for maintaining abstinence. And counselors and clients can practice ways to refuse heroin or to refuse to go to places where heroin is available. The ability to say no effectively in these situations is going to help clients to feel in control when they're faced with situations that are tempting. So one of the things that I will do is I'll actually have them role play saying no to someone. So for 3 minutes, one person will try everything that they possibly can to convince this client to say no or to use. And then the client's only response is no or no thank you. And teaching them not to put excuses or reasons behind their no, because it gives the other person ammunition to rebuttal the no. And I'll give them the example of I'll have someone ask me out on a date, and I'll say, okay, just ask me to go out on a date with you. And the clients will say, hey, Desiree, will you go out on a date with me tonight? And I'll say, oh, I'm sorry, I can't. I don't have a babysitter. And 99% of the time, the client will typically say in response to that, oh, well, I'll pay for your babysitter, or my sister will watch them, or you can bring them with you. And so I use that to help the clients to see that it is so easy to have a rebuttal when you provide that excuse or that reason behind your no. And we'll typically talk about sales training and how many people have been in sales and things like that. So, no means maybe. And if I can keep convincing you, then you're going to change. And I'll also let them know that their body language is going to give away how they're really feeling, because 85% of communication is body language. And so if I'm kicking my feet, twiddling my thumbs, looking down, then my body language is going to tell you that I really don't mean no. And if you keep pushing, I might just say yes. So looking them in the eye, keeping that open body language, and just saying no and meaning no, and just letting your no be enough. And I will also let them know that in the case of, we can't always avoid where people are using or drinking. We might have to go to the office Christmas party, or we may find ourselves in a situation where other people are using and we're already there and we have to be somewhere. In these cases, I will typically tell them to have someone that they can call in a situation, or to take someone with them that can be their accountability partner. Or for people who drink, I will tell them to carry their, if they have a feeling that there's going to be alcohol use at the party or at the place that they're going, to carry their own red Solo cup or get a glass in their hand in some way, shape, or form that's with water, tea, soda, something other than alcohol. And that way it will prevent other people from asking them if they want a drink if they see that they already have one. So little techniques that we can use when we're in these high-risk situations that can really prevent relapse are really going to help. So think of counseling techniques as just this set of options, like you might find on a restaurant's menu. The counseling techniques that you choose to use are going to depend on the individual needs for each client. So it's important to recognize that not all of the techniques will be needed by every single client. And we also want to note that the client needs might change over time.